Quick note before we start. This content is for educational purposes only. We are not promoting the use or purchase of any substances. Our goal is to explain science, regulation, and history. Always follow the laws in your country and consult licensed professionals for any health related questions.
Well, so hello everyone. Welcome to Eywa Academy. The idea of this space is to explain business, science, legislations, and policies around psychedelics in a really simple way for everyone to understand. And today I'm really happy to be with someone that I really admire in this field that has been working for a long time in brain health advocacy and legislation. Tadeusz. How are you, Tadeusz?
I'm very good, and I'm equally happy to be talking with you today.
Thank you very much. Well, Tadeusz, could you please introduce yourself, a little bit of your background, your career, and tell us what is Paria?
Yeah. So the most difficult part is behind us. My name, it's Tadeusz. Not everyone can pronounce it properly, so everything else will be easy. So my professional career has always revolved around a few kind of axes. One is the European Union policies and also a bit of WHO, so global health policies, because that's where the decisions are made for Europe, especially. That's where kind of you're at the source of decisions that are impacting all the European Union countries. The other axis is brain health. I find brain utterly fascinating, and I've been so privileged to work on the policy and advocacy side of things. So I'm not necessarily a researcher or scientist, but I've been always communicating about brain science and engaging with policymakers. And it's actually even easier not to be a scientist, because then, you know, they understand you actually. Maybe you don't go too much to the technicalities. And one extra axis is that I've always enjoyed working through multi-stakeholder civil society alliances, which bring a lot of different organizations. I think that it's a great model that opens a lot of doors. And this is how I modeled Parea. So I brought in all these different experiences, and a few years ago, I realized that in Europe, we don't really have any proper voice engaging with policymakers. I know that so many different areas are covered in Brussels. You have I think 20 or 30,000 lobbyists and all sorts of organizations like Koala Bear Association, water coolers, whatever. Like every single area that you can imagine has its voice in Brussels, and there was nothing on psychedelics. And I felt like my experience is really kind of lending itself really well to put something together. And the way I thought about Parea is that I wanted this to be really something that from the very beginning is optimized for community and for ecosystem and for representation and legitimacy. So it's a collection. Parea is a collection of members. We have 15 full members. Everything starting from patient organizations like Pain Alliance Europe or European Federation of Neurological Associations or Mental Health Advocacy Group in Europe, through scientific societies and professional organizations like European Psychiatric Association or Association of European Cancer Leagues, and even Women's Brains Foundation joined a few weeks ago, which I'm very happy about. And then ending on psychedelic foundations that do research, that do education. So this is Parea. We are really about community and building trust within communities.
Wow, I think that all that work and building the community with the different stakeholders, which obviously they have different incentives, it's a really important work, because you just cannot drive change or bring new things into the ecosystem if you don't understand each of these parts. So I think that what you do and your job is really, really important. And what I wanted to ask you is, like, you spend a lot of time doing this, but what led you to focus on psychedelics, and what connection do you see between this field and your broader work in mental health with psychedelics?
Yeah, so there are a lot of aspects of brain health and mental health. One of the aspects that are important is innovation, and especially in mental health. As you know, Victoria, we haven't seen much innovation in decades, really, many decades.
Yeah.
And this is contrasted against these massive unmet needs that we see with people that are affected by various mental health conditions or poor mental health. So we are speaking about conditions like anxiety, which is the most prevalent mental health condition, actually, depression, but also substance use disorders, also other conditions that have a very strong component of mental health, such as eating disorders, such as anorexia. So for all of these conditions, we haven't been really coming up with new tools to help people. And we really all know someone who is struggling with mental health issue and who hasn't kind of found relief through traditional therapies. So there are a lot of people that tried a lot of things and haven't been helped. And, sometimes we kind of diminish the mental health versus physical health, but the impact on people's quality of life is huge. For instance, there's been studies showing that that depression has been found to lower our quality and enjoyment of life more than death, more than divorce, or more than diabetes. So it has a huge impact on people. And at the same time, the prevalence is growing and kind of trends are really going in the wrong direction, even as more people seek care. And that's not true for many other conditions. It's not true for cancer. It's not true for heart disease, for diabetes, or almost any other area of medicine where we've made a great progress in the last years and decades. So this is really the backdrop. Another issue is that all the innovation that exists in the pharmacological space is really, mostly pharmacological, and it's focusing on managing symptoms. And treatments like antidepressants helped a lot of people, but I don't think we can place the onus solely on the individual or on the biology. We know that mental health conditions are far more than just a kind of messed up biology. There's the psychological factors, social, biological factors. So this is all to say that you cannot be active in the brain health space and not notice these things. And then around maybe 12 years ago, I started hearing about the therapeutic potential of psychedelics. They have, a bit of a gravitational pull about them, and you feel like you're more and more kind of sucked in. And that was the case for me. I got more and more interested with them. And really, for the first time in decades, anyway, we have these transformative treatments on the horizon. So this is, these are all reasons why I was turning my attention more and more to psychedelics, and also especially that they are offering this very different treatment paradigm to conventional psychiatry treatments.
Yes, definitely. So yesterday I was speaking at Eywa Academy with Dr. Barbara Garcia. You met her, I think, at La PsyConf here in Latin America. And what she was really enthusiastic about psychedelics is that also the model is being shaped around not letting go the patient, like the drug not being totally separated from therapy. How do you see this versus regular antidepressants?
Yeah, so as I was just speaking about the innovation and this new paradigm, the interesting thing about psychedelics is that the innovation lies in treating the medicine and experience and therapy as this bundled intervention. So when you look at psychedelics, they seem to be bringing psychedelic treatments, they seem to be bringing three elements. You have a drug, it's still a drug. It has a certain chemical or biochemical effect on the brain. Then you have the experience of the trip, so the psychological state that people are experiencing. And then there is also a third dimension where we can really say that the context becomes an intervention, because we know just how important these non-drug factors are, like a space where you're in, the context, who is with you, what do you know about psychedelics, do you feel safe in a given space. So I think this is something that is so interesting, and so this is now touching the core of my interests, because I feel like psychedelics, I don't really see them as another antidepressants. And I feel like we've been asking all the wrong questions, like how we treat anorexia, how we treat anxiety, and so on. And instead, I think what we should be asking is, how do we help people engage in the process of their recovery on their mental health journey? And that's what psychedelics are offering. So what's really important for me is that, in mental health, I'm really principled about one thing, and that's the agency. It's really this idea that the treatment is no longer done for people, like, taking a pill, but it's done with people. And we know that this healing is not really coming from external pills, but it's coming from within ourselves. And we have these innate capacities, just like with physical health. Somehow, it's interesting, because we can easily speak about healing in physical health. You say, I broke my elbow, I had an injury, it's now healing. But sometimes people, when you speak about healing in mental health, people kind of see this as a bit of a woo-woo. But yes, there is a healing aspect in mental health, and there is this intelligence of our minds, where they have proper circumstances, they really, we really can be agents of our own recovery process. And that's what psychedelics are doing when they are delivered in a really carefully designed container. So that's also very important. And so people, as they seem to be getting something really meaningful out of these psychedelic states, they get the sense of clarity. They can look within themselves without defensiveness, without fear, more acceptance. And here kind of the magic happens, because there is a biochemical effect as well. What's interesting about psychedelics is they seem to be increasing this neuroplasticity and opening these critical periods of brain plasticity, the type of periods that we see, for instance, in children, when your brain is highly plastic, when you're small and you learn languages quickly, you learn all sorts of things, kind of social behavior. So it's not even just neuroplasticity, it's these powerful windows of critical periods in the brain that can reopen. There is a kind of expiration date, if you like, on this reopening. It can be a few days, maybe a few weeks, but in this way, they are opening this window for a deeper behavioral change. And so what they seem to be doing is they are relaxing our beliefs, they are relaxing our assumptions, our expectations. And then if you do the actual work after the session and also before in a relationship with a trained therapist, then you can really start revising your malfunctioning beliefs and attitudes. And it takes a lot of work. It takes discipline, it takes intention, and it will not happen without, setbacks. But, there is this book by Jack Kornfield, after the ecstasy, the laundry, and it's a bit like that with psychedelics. There's a lot of work that needs to be done, but they are opening these kind of therapeutic opportunities. And we see a bit of tension in the field because it would be easier to have these treatments as typical antidepressants, and we see this with ketamine, for instance, when it's served, now with Spravato, which is an approved medicine, as a biological intervention. But I think what's so interesting, and I'd love to see really people viewing ketamine as this opening this therapeutic opportunity, and ketamine's kind of psychedelic effects as therapeutic opportunities, because they are now being suppressed by many companies. They don't want to see any kind of hallucinogenic or dissociative effects, but we know that it helps people. Otherwise, with ketamine, you see immediate benefits for a few days, people feel better, but then these benefits fade out within days or weeks. So, and then when you combine this with psychotherapy, when you build on this rapid antidepressant effect, that's where the real change can happen. So all this to say that it's a very different model, and I am happy every time there are new treatments and innovation, but I wouldn't set up an alliance if it was another antidepressant. I do this work because I really like that people are kind of front and center in this work.
Yeah, I think that's the really important thing. Like, you can bring a lot of innovation, but if the ecosystem is not ready to incorporate these new models, it will be really difficult to be inserted into society. And as we were speaking some minutes before about like building reliable business model or economic models where this can be sustainable, over time. So speaking about the work to be done, where are you seeing the most momentum in psychedelics policy right now? And what challenges remain to integrate this? Maybe economic models, business, stakeholders, incentives. How do you see policy right now, and well, those challenges?
Yeah, what I really like about psychedelic science is that there are so many clinical trials covering so many therapeutic indications, even more and more going towards neurodegenerative diseases like Parkinson's, but of course especially mood disorders. So we have several hundred, maybe like between 300 and 400 clinical trials. So there is a huge momentum, a huge wave. The train has left the station. We will see approvals. It's just a matter of time, and they will come. Really, probably more and more people are talking about a window between kind of 12 and 18 months, especially in the US. We might see approvals. So this is a huge momentum, a huge kind of scientific wave. Now the challenge is that we maybe focus a lot about just the act of approvals, but that's just the beginning of the access. And we know that for psychedelic therapies to be successfully integrated into health systems, we'll need a myriad of real-world factors. The equitable access has to be kind of baked in very early, fairness, so that everyone can benefit from these treatments without money being an issue. There is a challenge, of course, with engaging healthcare systems, and I think that one of the key drivers of the implementation will be the willingness and the ability of healthcare professionals, of providers, to include them in their existing practices. They will be the gatekeepers for psychedelics, and their beliefs, their attitudes. They will really be instrumental in terms of how quickly we can start scaling access. So this is why it's important that we start embedding this work more meaningfully into kind of powerhouses and trusted medical institutions. And this is why PAREA has among its members these groups like European College of Neuropsychopharmacology and so on, professional societies. And especially licensed groups will be important. So groups like psychiatrists, psychotherapists, and they have well-established safeguards. And it's so important. Like there is a lot of enthusiasm in the field, but we need these groups that have decades of experience with licensing, with formal enforcement of ethical standards to help us to come up with guidelines and ways of delivery. And so there will be a lot of things that we need to do around it, like formal training of therapists, and of course, developing practice standards. Really important will be rigorous monitoring of clinical outcomes. So it's kind of building capacities that mirror those in other healthcare professionals. But for me, really, from the Parea perspective and from my own perspective, is that we all should ask ourselves this question in terms of, or who is most likely benefiting, will benefit from psychedelic therapies, and how we can make sure that these people will have access. Because what I see now is that psychedelics, in whatever form they are available, they are mostly available either to people who dare to go underground, or those who can afford high-end retreats, private clinics. And that's great, at least someone has access, but we really need to think bigger, and we need to be aware of the data. One example is the OECD, Organization of Economic Cooperation and Development, released a report earlier this year showing how mental health is shaped by social and economic conditions, of course. And they show that people in the lowest income group have three and a half times more chances to experience depression compared to the highest income group. And so I really don't want us to perpetuate this vicious circle and cycle when we know that when you are in a low social economic status, it will worsen your mental health. And then when you have poor mental health, you will be further disadvantaged social economically to access treatments. And people that live in poverty, that have precarious jobs, they usually have the least resources to cope, and they have the greatest unmet needs. So what I want to think about as early as possible, once the approvals happen, is how we can make sure that these people get psychedelics, and they are not another privilege for the few. Like even with ketamine, I mean, there are millions of people with treatment-resistant depression in the US, and the ketamine was accessible last year, I think maybe to 30,000 people, 40,000 people, because it's so expensive. So this is not the future I want. But we need to focus on getting psychedelics to the communities that need them most.
Yes, I think that what you're mentioning is really important. I don't really think that business as usual will work for psychedelics, like trying to imitate like old ways of bringing a medicine to the market. I think that we should have like more a generic view, also because you already have psilocybin in nature. So here is where I think that technology, biotechnology, can really they both can be amazing platforms to make this as scalable as possible. And there's where I see like positive on what we're doing and the work we are doing together as a community. What I still see as a huge problem, and I see it because I don't know, some of our publications, when a newspaper brings out a news about psychedelics, there's still a lot of stigma around drugs in general, psilocybin, hallucinogens. In this sense, I really like the work that Professor David Nutt has done around like cataloging the different substances, where he, for example, explains that the substance that makes more harm to yourself and to others, it's alcohol, and the last one is mushrooms. On this same line, with this sort of stigma, what do you think it's the data that really matters right now to lower stigma on society?
Yeah, at the very basic level, what we need for people is to see psychedelics as valid and effective mental health interventions on pair with anything else that they can find in doctor's office. So this will be a long journey. It will not happen on day one, but it's the science, it's the education that is taking us out of ignorance and prejudice, which accumulated over decades, decades of bad press, fear mongering, and the highest schedules. So that's kind of one dimension. More broadly speaking about data, I think the challenge is that psychedelics are not very easy therapies to conduct clinical trials with, and there are major issues with things like placebo. So what we are pushing for, and what we think that the whole process of implementing, rolling out psychedelics and making them more acceptable could move faster if we start implementing these treatments in real world settings while they are still being researched, so that we have kind of both.
Yeah.
But when we would be doing these both approaches at the same time, we could really have a much more holistic view on how they work, and also not just understand if a treatment works, but how we can deliver them to patients, how we can deliver them at scale. And we could imagine, programs that have this harmonized data collection across different countries and, different treatment centers, and then we could really have a boost of knowledge when it comes to their safety profiles. It could inform patient selections. It could refine dosing strategies, could help us to capture long-term outcomes, because this is another kind of shortcoming. And so in general, we could have this data complementing the clinical trial data and accelerating implementation. And especially with like long-term outcomes, the issue is that psychedelics may come with substantial upfront costs because of they are resource intensive, and we can kind of lose, payers can not see enough their long-term benefits, such as recovery, reduced relapse, improved functioning, because this is more difficult to capture with the short assessment horizons. So that's why the kind of real world application could help us to answer these questions and make psychedelics accessible to people who need them sooner.
Yeah. Tadeusz, one more question before we wrap up. What's your dream on this field for the next 10 years?
Yeah, so I like to think in like 5 to 10 years periods of time, because then you can really start seeing something happening. Otherwise, you're bracing yourself for disappointment, I guess, because these things will really take time. So yeah, 10 years is like a reasonable amount of time to maybe starting seeing some change. And let's not forget, things really take time, and it's not like I don't want to see things, certain things ahead of us as challenges. Rather, I want to see them as stages that we have to go through. It's like when you look, say, at the stroke care, everyone now knows that stroke care is important, and we invest a lot. And there was a decision that stroke is a public health priority, but it was not always like this. And it took a few decades for stroke to go from like a very myopic care with neurosurgery. People had no idea that the physical rehabilitation is important, occupational speech therapy, psychological support, whole kind of teams, multidisciplinary teams coming together. And it took a few decades. Now we are where we are. We have stroke centers and an amazing care, but it took a while. So that's just like one remark when we think about what can happen in the next 10 years. It will be taking time, and it's normal. That's how things work. Of course, we would all want to have faster access to as many people as possible, but we need to really balance this with safety as well. But yeah, I mean, my hope is that in 10 years, everyone really understands that psychedelics are, medicines that they are evidence-based, that we make them as quality healthcare interventions. And for me, quality will mean that we have integrated teams that help people not just during the psychedelic session, but also before and after, that we have proper aftercare, that we have this scaffolding where we have like a suite of tools where people can go, starting with counseling, psychotherapy, psychological support, connecting people with their peers and letting them continue through peer support networks, developing digital tools, and most importantly, creating this community container where we reconnect people with their local communities. This will not all happen in 10 years, but in 10 years, I hope that this is already part of healthcare systems, of kind of mental health treatments that help people who have not been helped with other treatments. And we start, seeing something that is the most important, like we see happier, more patient moms and dads that are coming back home, and people are just living more fully filled lives. So that's the direction of travel, and in 10 years, I is my hope that we'll be getting closer to that vision.
Tadeusz, thank you very much for your clarity, for your work, and well, for of course being here in Eywa Academy. Wishing you the best for the future and that those dreams come true.
Yeah, thank you. And I want to say, I had such a privilege to be in Buenos Aires just weeks ago, and you have such a beautiful and incredible community there. So I really want to warmly congratulate you being part of this beautiful ecosystem, and yeah, just expressing my gratitude for experiencing this myself as well. Thank you.
Of course, we wait for you soon.
See you soon.